This is Corey Drinkett. We are going to go over the next 10 instruments in our instrument sets. This is the sixth set. The first one is the cryoforceps. This is a hemostatic forceps. It's used to control bleeding, manipulate tissue. Everyone gets this confused with the Kelly forceps. Just remember the Kelly forceps, the serrations go about halfway down. The cryoforceps, the serrations will go all the way down the jaw. It comes in a curved and straight. It comes in a couple different lengths. Just remember, also it will be sterilized in the open position. The next one is the Foerster sponge forceps, or just the sponge forceps. This comes in a 7.5 or a 9.5 length. It will come with either a smooth jaw or a serrated jaw. It's really just to hold sponges. Well, in the procedure, they will use it to either sop up any type of fluid within the wound, or just to manipulate tissue out of the way. This is the Lorna towel forceps, or as known as the non-perforating towel clamp. It comes in a 3.5 and a 5 1/4 inch. It's really just to hold surgical tubing or cords onto the surgical field after they drape. Just because this will not penetrate the draping and make a hole into the drape. The next one is the Alice forceps. It does come in different lengths. The teeth on the Alice forceps will either be a 2-3, 3-4, 4-5, 5-6, or 6-7. It's just really just to manipulate tissue out of the way, grasp onto any type of organ type of tissue and all that. It's mainly used with it's used in a lot of different procedures, so it just depends on what procedure they are using it for. The next one is the Pennington forceps. It's almost like a triangle type deal. The jaws has a serrated. The jaws are serrated. It's used to clamp delicate tissue because it will not it won't tear. These are mainly used in GYN, mainly in C-sections, and in rectal procedures. This is the snit, or what's also known as the tonsil clamp, or the Addison tonsil clamp. We just call it a tonsil clamp. It does come where it's lightly curved or fully curved. The serrations go about halfway down the jaw, and it's really just, that's what it's usually hold. It's just usually hold to grasp onto the tonsil tissue forceps in the back of your throat. This is the Leahy forceps, or the Leahy thyroid. It comes in one length, that's 6 1/4. It's to manipulate tissue. As you can see, it has teeth. It is very sharp. It's mainly used on mastectomies, grasping the breast tissue, or in thyroidectomies to grasp onto the thyroid gland. This is the Backus towel clamp, also known as the perforated towel clamp. It does come in two sizes, 3.5 and 5.5. This is used, they are very sharp. It's used to hold sterile, the towels that they use when they drape the patient before they put the main drape over the patient. they usually will put outline where they want to be with towels. They usually secure those towels with the towel clamps. This is the clip plier. It comes in a couple of different lengths. It's used to control bleeding. They come in different sizes: a extra small, small, medium, large, extra large. Some of them come with the more of an angled tip. Be careful with the color coding, because they are color coded according to the type of clips that they hold. So if it's a red hand, if the clip plier has red on it, it goes with the red clips that they use in the procedure. So that's how you can tell the size is by the color of the ring handle. And last is the Cushing vein retractor, or just a vein retractor. And that's what it is. It just really holds veins back. It's mainly used in neurosurgeries because it's so delicate. And it just retracts the veins and the vessels and stuff like that out of the surgeon's way.